Mystery illnesses are on the rise. What are these and what am I even talking about? Mystery illnesses are those kind of illnesses that no one can quite figure out. You go to multiple doctors or specialists and they don't quite know what's going on. Now, historically, these have been around for quite some time, actually. The original great imitators was the old term we used to use for them. Originally was syphilis back in the day. You could get it in your 20s, early 30s and not have symptoms for decades. And when you had symptoms, they're weird, joint aches and pains, cognitive issues, but it could turn into heart issues. It could turn into heart failure. It could turn into dementia, lots of strange things. Tuberculosis or consumption, another mystery illness. The consumption was a term when you basically like almost just kind of withered away. Your body consumed itself. That was a chronic infection actually of tuberculosis. And we knew what these things were. They had like a recognition of them. It wasn't until, modern times with antibiotics, we've been able to eliminate these. And we have a whole host of new mystery illnesses that are being overlooked. But the nuance is these are multi-system, multi-symptom illnesses. What I mean by that is they involve different body parts, brain fog, confusion, cardiovascular, shortness of breath, blood pressure issues, gut issues, energy levels, aches and pains, a whole lot of different things are included in these mystery illnesses. So what I want to do is talk briefly, do these little short 10-minute mini episodes and talk about some of the big mystery illnesses, do an overview here, talk about what they are, and actually give you some information that can be helpful to figure out if you or a loved one are dealing with this and how to approach those. If this information is helpful, please like, share, subscribe. This is something that patients have put forward to us and asked us about, and I want to share about that. There's several big mystery illnesses that are multi-symptom, multi-system, look kind of weird. And they all look about 80% the same, which makes it confusing. So what am I talking about? There's your chronic Lyme disease or post-Lyme syndrome. There's your mold-related illness or chronic inflammatory response syndrome. There's dysautonomia, which is a neurological condition. There's mast cell activation syndrome. And then autoimmune issues in general, or autoimmune diseases in general. These are 5 of the mystery illnesses that we're dealing with in our culture, in our country today. So we're going to walk through these 5 different, these 10-minute talks to give you some information about these so you can kind of know what we're talking about. The first one I want to talk about is chronic Lyme disease or post-Lyme syndrome. It's interesting because Lyme disease is actually a spirochete, which is a similar shape. Spirochete just describes the shape of the infection particle, intracellular organism, is what syphilis is actually. So that's kind of interesting that the modern day great imitator actually is in a similar family as the old day syphilis. And it can be treated with antibiotics, but it's a little difficult to cure with simple antibiotics if it's been around for a while. Now, so what are some of the symptoms of chronic Lyme disease? It can be joint aches and pains, migrating pain, neurological symptoms. You can have brain fog, headaches, nerve pain. It can result in autoimmune issues. Getting chronic infection can give you autoimmune issues. So you can see these can combine with the autoimmune as one of the great imitators. Gut problems, gut issues, a whole host of other symptoms. And now all of a sudden you can kind of appreciate how this can look like many different things and be quite unusual. So how do you diagnose this particular chronic infection? This is where it gets a little interesting because the current CDC guidelines recommend it's just a regular IgG test, a blot type test. And the issue with that is that according to the CDC, half of all people who have Lyme disease, their first screening test is negative. So that makes it a horrible screening test. So then you go on to a Western blot if you have suspicion, which is a next level testing. The thing about Western blot is the typical standard lab Western blot test. One, it's not as sensitive. It takes a stronger signal to become positive, which many people with dysfunctional immune systems don't have. The second thing is 2 of the bands in the testing have been removed because if some of you may remember, there was actually a Lyme disease vaccine years ago. And that's been, that actually when that came out, they removed those particular bands from the Lyme testing. And so all of a sudden now, we've lost the ability to have as accurate testing. Now, there are better tests like IGeneX, Vibrant Labs, Galaxy Labs. These are places that use higher technology, higher resolution, test for more parts of the actual organism. But unfortunately, insurance does not cover those. So for the mass population, most people were limited to the standard insurance covered labs, which the initial screen will miss 50% of people that have it. And then the other testing gets kind of tricky because you have 1 band versus 5 bands and gets almost requires you to have like a certain skill set on being able to figure out what symptoms go with it. And then certain bands are actually more specific than other ones. So like 41, for example, you can see in people with a positive ANA or early lupus or Epstein-Barr herpes reactivation. So it's not specific for Lyme. And other bands like a 58 or a 23 can be more specific for Lyme. So Lyme disease is one of the great imitators. So if you're having like a typical presentation, you've been to multiple people, have you been checked for Lyme disease is the first question. The second question, if they say yes, what test did you have? Do you get a Western blot that put all these bands out there? Or did you get a simple antibody test that said negative or positive for Lyme? And if it just said negative and they didn't move on, then you didn't get the best test you should get. So kind of curious how many people out there have experienced issues with their diagnosis being overlooked, be missed, and later found to be Lyme. It's a lot of people. According to the Center of Disease Control, every year there are more new cases of Lyme disease in our country than breast cancer. So this is obviously a big thing and something we should have on the radar, and we should be aware of the more advanced testing and things to think about. So that's one of the 5. Next time around, we'll talk about the next of the mystery illnesses and some nuances about that. Take care. We'll talk to you soon.